everybody, welcome. It's Dr. Brown from Canis Chiropractic, your Baltimore area chiropractor. Today I'm going to show you how we adjust somebody that is pregnant. This is Megan. She works for us. Meg, stand
Hi, guys.
up. She's due tomorrow.
Yes.
So we're going to adjust her. I'm going to stretch her low back. Her back's been bothering her. We're going to adjust her hips. Maybe try to get things stimulated down there to get this baby out because she's...
horribly miserable.
Right.
We're going to have a baby tomorrow.
We're having a baby tomorrow. Okay. So look. Everybody wants to know when they come in, what do you do for a pregnant person? Can they lay down on the table? How do I lay face down? Well, I'm going to show you. We have a special table that's used to treat patients that are pregnant. And what happens is the belly drops, the middle piece drops down so your belly can rest comfortably. So, Meg, lay on your stomach. And it's fairly comfortable, right, Meg, laying there?
Yeah.
Bother your stomach or anything like that?
No, not at all.
Okay. So what I'm going to do is I'm going to stretch her. So she's pregnant, belly's going out, your belly goes out, your back goes into extension, so things start to get compressed. She's starting to have pain down the back of her legs. So what we're going to do is we're going to stretch this out. This is a special table called a decompression table. It's going to take the joints and it's going to pull it apart, which is going to feel really, really good for her because everything she's doing right now is compressing it. So this is going to give her a lot of relief. And then I'm going to adjust her on her sides and we're going to adjust her hips, get things moving around, and we'll see what happens. So this is what we do. Feels really good. We're going to strap her legs in. What happens is this. She's going to hold on at the headpiece up there. And this table, if you want to show them right in here, is going to separate. And when that separates, that's called distraction, and that helps to pull apart the joints. And this can go about anywhere from, I guess, 4 to 12 inches. And now what we're going to do is we're going to flex this down, which is going to help to get some pressure off of there. So things are being compressed, which means they're being squashed together. When they get squashed together like this, we want to pull it apart. So the table already pulled it apart. Now we're going to flex it down, which is going to open up the back of that joint. And this feels pretty relieving. What's that feel like, Meg?
It feels good.
It feels
I
good.
can feel it pulling it apart.
Right, she can feel it pulling apart. It's doing exactly opposite of what's going on with her during the day. Since her belly's out so far, her back is being compressed, so this decompresses it. And we'll just work all the joints in your back. You got 5 vertebrae, so we're going down each one on her. We don't need to be super, super specific. She doesn't have a disc problem as far as a disc herniation or a rupture or anything like that. She just has compression, and compression does affect the disc, but no specific disc on her. Everything in that area is being compressed. So this feels good. And this will make her feel better. She's going to work today. And we'll see. Felt good, right, Meg?
Yeah.
Okay. So now what we're going to do is this. We're going to push this table back together a little bit. And then we're going to adjust her hips. We want to get everything open. Everything's tight, everything's being compressed, so we want to adjust the hips to get some mobility. So what she's going to do is, Meg, you're going to just push your belly up, and I'm going to push this up. I'm going to lift this up. And you're going to lay on your side and face me this way. We'll hold her. We don't want to come rolling off. Not as stable as she used to be. So this will adjust the hips. Scoot back a little bit. There you go. Good. And what she's going to do is she's going to relax, and we're going to adjust this pelvis, which is going to open up the joints and the hips on this side. Good. And now she's going to flip on the other side. And this is, you all right?
Yeah.
Not easy, huh?
No.
Scoot toward me. Good. And now we're going to adjust this side of the joint. She's going to open up this side of the pelvis. Just relax. Good. And that was good. You all right? All right. Come on, mama.
Okay.
All right. Can you stand? See if you can stand.
Yeah. Feels good.
Right. It feels good because we got the pressure off here. We'll keep you updated on as to Megan's progress. She's due tomorrow. We all have bets to see when she's going to go. I think it's going to be next week, but
Don't say that.
we'll see. All right, everybody, thanks for joining. Subscribe to my YouTube channel. We'll see you next week for another video. And remember, pain's not a lifestyle.